Well, one of the key things that I find is that whenever a new patient comes to our office, they may be hesitant about actually having x-rays taken, and when we delve deeper into that hesitancy, 99% of the time it's because they're afraid that they have to leave our office and then have to wait 2 to 3 hours or more sometimes to actually have that x-ray taken and then come back to our office to have it reported, and therefore really have a delay for sometimes half a day or a full 24 hours before we can actually start any care. And for some of our patients, they come in with quite acute problems and a lot of significant pain and discomfort, and if they would have had to wait 24 hours, that can be a real disservice to them. And so for us, having the x-ray on site again removes that barrier for this patient starting care in almost all cases. When we mention, well, we actually have that here on site, they go, really? So I don't have to go anywhere? I say, yes. We've invested in providing you with the best service possible so that we can evaluate your spine and your health as good as we can and as quick as we can, so that we can get that road to recovery started sooner. When our machine actually went down for a couple of months, we again had to refer out for 2 to 3 months. And just the quality of x-ray really dropped dramatically because people were either standing a little bit turned or facing the wrong way, or just the quality of the image that we got back was just of a poor quality, meaning that we actually had to resend a couple of patients back to the other radiology site in order to get a more quality image. And being in control of that quality here in our office, we can ensure that we get a great image every single time, first time, and again give a better result to the patient and really give them a better diagnosis because we've got that good quality image. When I first purchased the practice, there was a wet film, so we were in a dark room, dingy, dark, didn't know what was going on. And, that was a real disappointment because sometimes we would take an x-ray of a patient and then it would come out and the quality of it was just sheer horrible. And in order for us to be able to get a better quality image, we upgraded to the CR. And I would say that by doing so, with wet films, our average of a great film was probably about 80%. And of those, again, lots of the quality of those images were below par, and we had to retake. So now with the CR, we're getting better quality images. We are able to see the image faster, and the amount of retakes we've had to take is maybe 1 in 100. It's absolutely so simple. I mean, it goes directly from our CR unit down to ICS, and they take care of it at their end to make sure that a report gets generated on that x-ray, which is another thing, which is fantastic, making sure that someone gives us a second opinion and also an opinion on those x-rays. But I mean, I don't touch really anything. It all goes online. The only thing we have to do is create a RadZen online request for that x-ray and make sure that we receive that report as soon as possible. Yeah, a couple of times when I've seen an image and I've gone, wow, that actually looks pretty scary, that could be something serious pathology, or look, I'm not quite sure what's going on with this image. I can pick up the phone and be on the phone to the radiologist within an hour, sometimes within minutes, and actually ask for his opinion directly. And that just means we can get an answer back faster to the patient. Generally, I deal with a particular radiologist, and we get along great. I've even sent them a few abnormal x-rays, congenital variances and so forth, and we have a good discussion about it. And it's a great mutual respect. Well, generally, if you pick up the phone and ring, you get an answer straight away, and they always do the best to try and get back to us as soon as possible with any requests. When our machine was down, they say, not a problem, and within 24 hours, a new one was in the post, and that's a DICOM machine, and we're up and running again. And they're always courteous, always friendly, always happy, and they're a great bunch of people. Yeah, very much so. You know, that the flat fee that we receive every month is a great way to make sure that the overheads are contained. It allows us also to reinvest into our machine, make sure that we upgrade it, service it, and really make sure that it's always running 100%. Allows us to employ great staff to make sure that the service is available on site, and overall just make sure that business can flow smoothly. I wouldn't think about it a second. It'd be something that I would always do. Any practice that I would open from this point on would have an x-ray there from the start. You know, before I was even a chiropractor and in the student days, all my mentors had x-rays on site, and I saw the benefit that it brought to their patients. And it was just a no-brainer that when I owned my practice, I wanted the best quality equipment in my practice so I could give that same service to my patients. So really, if it came to installing an x-ray machine, I wouldn't even think twice about it. And actually, funny that you should mention that, when I was on wet film, the cost of actually keeping the machine running in terms of film, liquids and so forth, was actually more expensive than the payments for a CR unit.